Back every time Dr. Tiff is here, we learn something new. He is the doctor behind Siragusa Vein and Laser.
Yes, and it's not just about cosmetics and reducing the look and size of varicose veins, but these symptoms can be just the root of much bigger issues. Today, he's here to tell us all about the signs of venous diseases. Welcome back.
Thank you, ladies.
Yes, you have to fill us in on when we need to see a specialist when it comes to these veins and spider veins too.
Right, when to see a specialist. You have to remember varicose veins are not only cosmetic. Everybody thinks of them as cosmetic, but they can also develop into a health problem. So when to see a specialist, if the cosmetic component of them bothers you and you're embarrassed about your legs and want to do something to make them look better, that's one reason. If you're not really concerned with that, but you develop heaviness, pain in your legs, even further down the road, itchiness on the skin and even some skin changes that can develop into sores, that's a much bigger reason to go in and get your legs treated. So it really has to do with where you are as far as your symptoms and your comfort with how your legs look as well.
Okay.
Yeah.
What can happen if you don't get them treated?
So vein disease typically will just have a very predictable history of getting worse over time. I've never had a patient who thought, oh, each year after I developed varicose veins, I noticed they started getting smaller. They always get bigger. And so eventually people get to a threshold where either their husband, their wife, their mom, their sister, somebody tells them, listen, you got to get this taken care of because things can get pretty bad.
And we have some pictures to show just how bad it can get. Walk us through some of these that we're looking at.
Yeah, so this one is a pretty typical pattern of vein disease. It's along the inner part of the leg. The vein that really has the original problem that sets this all into motion is the saphenous vein, which runs along the inner part of the leg. Picture like where your inseam would be in your pants. And that vein should be bringing blood back up to your heart, but when the valves inside that vein fail, blood moves backwards, pulling up in all the veins below it, causing them to stretch out like that and become distended. Yeah.
Wow. Okay, and here's another before and after. I mean, truly, it speaks volumes, these two photos butted up next to each other. What's happening here?
So this is also a similar pattern where the pressure in the veins has gotten so high that it stretches them out beyond what they're capable of withstanding. So this patient also had itchiness in the skin over those veins because the varicose veins are forming in the drainage system for your skin. So basically think about the fact that your heart's pumping good blood down to your legs, right? And then that blood has to get back up. And when it's coming back, it's already dropped off the oxygen and nutrients and it's picked up a bunch of stuff that you don't want down there. So if your drainage system isn't working right, you have all this buildup of carbon dioxide, lactate, different things that can cause problems to the skin because it's not draining those things out of there properly.
And then we're going to look at one more here in the thigh area there.
This is another typical pattern. These veins can start up in the thigh as close to the groin. Some people just have them in the calf, on the inner part, outer part. It's really random as far as how that pressure as it comes down the leg, which branch it comes out and decides to really stretch out on the leg. But it's all caused by the same underlying disease, which is failure of the valves.
Wow. And you know what's so cool is when we go to see you, when any of your clients come to see you, it's a quick, easy process and it doesn't involve surgery.
Right, yeah. So vein therapy has come a long way in most centers at least. And the procedures we do take 10 minutes or less, involve local anesthesia. Some of our patients are really nervous about needles, and for them, we have nitrous gas. It's called Pronox, which is a little combination of nitrous oxide and oxygen. So they can huff on that for a little while and makes them a little bit more relaxed. But the procedures, like I said, no downtime, no stitches, no hospitals. Most people go back to normal life, interviewing people and just going grocery shopping for your tiny chef.
Yes.
Yeah.
Yes.
Well, all those that we looked at were in your legs, but you guys also do facial treatments as well.
Right, yeah. So another area, and there are really two categories of the facial veins. First is like the spider veins, the little small ones that look like people wrote on there with a little red colored pencil. And those do great with laser treatments that just kind of zap the surface veins. We also treat larger facial veins that are usually right around the eye or temple area, or the one that runs down the forehead that often photobombs people. So those therapies have become pretty popular. We have patients flying in from all over the country. Had someone flying from Guam a couple months ago to get this done, and the results have been amazing, yeah.
Wow. Wow, that's incredible. And that's not the only thing that you provide at your office. You basically do it all. Fillers, injectables, Botox, all the things.
Right. Whatever you want, we've got it.
Very good.
Got you
Love to
covered.
hear it. Thank you, doctor.
course.
Yes,
Appreciate
thanks
you.
for coming in. If you have veins that you want to get checked out, make sure to go to NashvilleVeinCenter.com for more information about services and how to book your appointment.